Many patients stop sertraline in the first 2 weeks because of side effects, but not all of them are dangerous. Some are common and temporary, while others are serious and need attention. In this video, I'll guide you through what to expect, what to watch for, and when to contact your doctor. Sertraline works by increasing the level of serotonin in the brain. Serotonin is a natural chemical that helps regulate mood, anxiety, sleep, and emotional balance. The same increase in serotonin level can also cause unwanted side effects, especially early on treatment. In the first 1 to 2 weeks after starting sertraline, body is adjusting to changes in serotonin levels in the brain. This adaptation is normal, but it can cause temporary side effects such as mild nausea, slight headache, and feeling a bit restless or anxious. These early effects are usually mild and short-lived as your body gets used to the medication. While these first-week effects are often mild, there are several other common side effects you should be aware of. We'll cover the complete list in detail next, including tips on what to watch for and how to manage them safely. Now that we've seen what may happen during the first couple of weeks, let's take a closer look at all the common side effects you might experience while on sertraline. The number one common side effect of sertraline is gastrointestinal effects. Sertraline increases serotonin level not only in the brain, but also in the gastrointestinal tract. The high level of serotonin can temporarily affect stomach motility and secretion, leading to mild nausea, diarrhea, or dry mouth. These symptoms are mild, and we'll cover practical strategies to manage them in the pharmacist counseling section later. The next common side effect of sertraline is early anxiety and restlessness. During the first week of treatment, increased serotonin activity may temporarily stimulate certain brain circuits. As the body gradually adapts, this activation typically stabilizes. During this early phase, patients may experience symptoms such as anxiety, restlessness, or a mild tremor. Sexual dysfunction is the next common side effect of sertraline. Sertraline can affect serotonin pathways that regulate sexual function, and sometimes causing reduced libido, delayed ejaculation, or difficulty achieving orgasm. These effects are dose-related and can appear in the first few weeks or later. Weight changes is the last common side effect of sertraline. Long-term use of sertraline may slightly influence appetite and metabolism through central nervous system pathways, which can lead to weight changes in some patients. Early in treatment, weight change is usually minimal. We'll cover tips to maintain a healthy weight while on sertraline in the pharmacist counseling section. While most side effects of sertraline are mild, it's important to be aware of some rare but serious reactions that require attention. Let's go through the clinically significant side effects you should know. Number 1 serious side effect is serotonin syndrome. It occurs when serotonin levels become excessively high, overstimulating the nervous system. Serotonin syndrome can lead to life-threatening complications, including rapid heart rate, tremors, severe agitation, and marked muscle rigidity. Another serious side effect of sertraline is hyponatremia or dangerously low sodium levels in the blood. Sertraline enhances central serotonin activity, which can stimulate hypothalamic release of antidiuretic hormone, ADH. Excess ADH causes the kidneys to retain more water than normal, which dilutes the sodium in the blood and can lead to low sodium levels. Low sodium levels can lead to symptoms such as confusion, headache, or dizziness. We'll discuss which patients need monitoring and when to seek medical advice in the pharmacist counseling section. Sertraline can slightly increase the risk of bleeding, particularly if taken with other medications that affect clotting. Platelets do not produce serotonin on their own, they absorb it from the blood. Serotonin helps platelets stick together and form clots. When you take sertraline, it blocks the serotonin transporter, the protein responsible for reabsorbing serotonin. This happens not only in the brain, but also in platelets. As a result, platelets cannot take up and store enough serotonin. Without adequate serotonin inside them, their ability to stick together and form strong clots becomes weaker, which slightly increases the risk of bleeding. We'll review practical precautions later to minimize this risk. Activation of mania in bipolar disorder is another serious side effect of sertraline. In patients with undiagnosed or latent bipolar disorder, sertraline may overstimulate mood circuits, triggering manic or hypomanic episodes, including elevated mood, increased energy, or impulsive behavior. The last serious side effect of sertraline is suicidal thoughts risk, which is age-specific. Sertraline can slightly increase suicidal thoughts in children, adolescents, and young adults, possibly due to early activation before mood improvement. Now that we've covered the common and the serious side effects, let's talk about when you should stop sertraline immediately. Although most reactions are mild and manageable, certain warning signs require urgent medical attention. Number 1. Severe allergic reactions. If you notice a widespread rash, swelling of the face or throat, or difficulty breathing, this could signal a serious immune reaction. In that case, stop the medication and seek emergency care immediately. Number 2. Watch for signs of serotonin syndrome. Symptoms like a very rapid heartbeat, high fever, severe agitation, muscle stiffness, or tremors may indicate that serotonin levels are dangerously high, overstimulating your nervous system. This is rare, but it requires urgent medical attention. Third important warning sign is something especially important for younger patients. In adolescents and young adults, if there is a new or worsening suicidal thoughts, extreme restlessness, or drastic mood changes, the medication needs immediate medical reassessment. Recognizing these warning signs early can prevent serious complications. Now, not every uncomfortable side effect means you should stop sertraline. In many cases, the safest step is to contact your healthcare provider, not discontinue the medication on your own. For example, if you're experiencing persistent nausea, diarrhea, or headaches that last beyond the first couple of weeks, your body may still be adjusting. Sometimes these symptoms improve with time, a small dose adjustment, or simply taking the medication with food. Mild sleep disturbances or sexual side effects are also common. These often don't require stopping the medication. Adjusting the dose, changing the timing, such as taking it in the morning instead of at night, or allowing more time for your body to adapt can make a significant difference. Early anxiety, restlessness, or feeling slightly more activated can also occur in the first weeks. In many cases, this is temporary. But if it becomes uncomfortable, your provider may slow the titration or provide short-term support. What's important to understand is, stopping sertraline suddenly can lead to discontinuation symptoms, such as dizziness, irritability, nausea, or electric shock sensations, and may increase the risk of relapse. That's why contacting your healthcare provider before making any changes is critical. As a pharmacist, these are most important practical tips I tell my patients. First off, dosing consistency is key. Take your sertraline at the same time every day. Why? Because timing matters, especially when it comes to your sleep schedule. Now, when it comes to administration, you can take sertraline with or without food, but if you're experiencing nausea, having it with food may make it easier to tolerate. Keep a close eye on your mood, sleep patterns, and any new or unusual symptoms, particularly in the first 4 weeks. This early monitoring helps you and your healthcare team adjust if needed. Be cautious of drug interactions. Never combine sertraline with other serotonergic medications without your doctor's supervision. This is critical to avoid serious complications. Finally, a little reassurance. While most side effects are mild and temporary, remember that serious events are rare. So, stay calm and trust that your healthcare provider is there for any concerns. Lifestyle tips are just as important as a healthy sleep schedule, physical activity, staying hydrated, and eating a balanced diet will not only support your overall well-being but also help your body adapt to sertraline. Most patients tolerate sertraline well, and early side effects often improve within the first few weeks. By knowing what to expect and when to seek help, you can safely continue therapy and achieve the full benefit. If you found this video helpful, don't forget to subscribe and hit the notification bell for more professional medication guidance.